Well, MRSA in our hospitals in 2005, over 500 people died of MRSA in Ireland. Now, that figure is huge when you consider that less than that died on our roads, and you think of the huge hullabaloo there's about the road deaths. And yet, these people died from a totally preventable infectious disease that they caught when they went to hospitals in Ireland. And the first thing you have to look at, what is the reasons for that? Why did these people die? Why did this happen? And many people are now afraid to go to hospital because they're afraid of what they'll catch when they get there rather than what they actually go with. And it happened basically because poor hygiene, overcrowding, not enough staff, structures not being done properly. Why is that the case? Is it a management problem? Is it a staff problem? Is it what's the problem for all of this? And the funny thing is, when you go and you talk to the nurses and you talk to the people on the ground, you talk to the people who are at the coalface, who are actually working in the health system, they'll tell you that the problem is that they're overcrowded, that they're too busy, that they haven't got the staffing levels to deal with it. You know, and there's many people, not just the nurses, but the other people who work in the hospitals, the cleaning staff, the staff that work in huge areas of it, who are doing a great job and who are often also undervalued, just as the nurses are undervalued. These people are also undervalued. And they'll tell you the same thing, that it's crisis management. It's trying to make things move forward when it can't happen. We have people lying on trolleys that should be in hospital wards. We have people in hospital wards that are overcrowded. 6-bed ward with 8 beds in it. That type of thing is the problem. Then you don't have the level of staff in there to deal with it. 3,000 beds was taken out of the Irish hospital system in the 1980s when Charlie Haughey implemented a series of health cuts. Until that's put back in there, you're going to have this crisis. Now, to deal with MRSA specifically, other countries, and we think of Holland is an example. At a recent conference in Waterford, a nurse came over from Holland and spoke about this. What they have done is they have put in a kind of a search and destroy policy. They've put a directorate in place. As soon as MRSA is detected somewhere or any other infectious disease, they send a team in there to deal with it. That team close the place down, they allow nobody in or out, they have isolation rooms that they put people into on their own, they disinfect, sterilise the whole place all over, and then they deal with the problem. How can that happen in Ireland? It can only happen in Ireland if the energy is put into it and the urgency. Now, I hear people, and I've seen television programs where the person that the HSE has put in charge of this is talking about how they're investigating as to how it can stop, and they're doing some kind of a look at other countries and what they're doing. They should have done this years ago. Doing it now is no good, and they're acting as if this is a new problem that's all of a sudden come to public attention. It's a problem that's been around in years, and there has been a huge cover-up all over the place of this happening. MRSA is a problem that can be dealt with effectively and efficiently if we put the amount of energy, the amount of emphasis into solving the problem that we put into other things. Now, if the same energy and the same effort and the same enthusiasm put into that as was put into, we'll say for instance, preventing Shell C protesters from stopping lorries from going into a place in Mayo, well, I think MRSA will be solved. But you see, the Shell C protesters are opposing somebody who is in the pocket of government and whose government is in the pocket of. And that relationship between big business and government, you know, if only the relationship and the relationship between the people who are sick in government was as good, well, a lot of these problems will be solved. And that's really what you're talking about here. You know, it's about making sure that they take this seriously enough, and to date it hasn't been taken seriously at all.